boss. My friends call me Arnie. You guys can call me Arnold. Just kidding. I'm a podiatrist. I've been practicing in West LA since 1981. My first practice was on Wilshire and Barrington, and then we were on National and Sawtell, and then we moved to a bigger facility, which we've been at for 22 years, on Westwood near Olympic. And thankfully, we have a very successful practice. We also have a second location in Santa Monica and a third location at Brotman Hospital. And we're very fortunate. I have really nice staff that work for me, and I have wonderful doctors that work for me as well. We take care of patients in our offices. We have patients in the hospitals, and we also have patients in nursing homes and home care. So we kind of have the whole gamut of treatment for anything foot and related that we can take care of. People ask me, why did I get into this field? And it's really manifesting the reason that I got into this field. About 30 years ago, a relative of mine said, have you considered looking into podiatric medicine? And I said, what's that? And he started telling me about it. He said, you know, it's really going to be an important profession in the future because so many people have an increased longevity that we're seeing. And this was in the Wall Street Journal. And by seeing that there's only 5 podiatry schools in the whole country, this was in 1975, now there's about 8 or 10. A new one just opened up that I'm actually teaching at in Pomona. But now there's 8 or 10, but projecting to the future, the Wall Street Journal saw in 1975, with the graying of the population, that there would not be enough podiatrists to take care of all the foot care needs of the country. And it's definitely proven to be right. I'm very blessed. I have a very busy practice. And on top of being very busy, I happen to like what I do. So those are 2 really excellent features. I went to high school at Fairfax High School. I ran track and cross country. I still run to this day. And I play a lot of golf. And I have children and grandchildren and a very nice wife. And I went to UCLA. And my podiatry school education was in San Francisco. And my residency was in San Francisco as well. And I had a very interesting residency program. It was a combination of 1-year surgical residency and a 1-year fellowship in biomechanics of the foot and ankle, where I learned about shoe modifications, inserts in shoes called orthotics. I own and operate my own orthotic laboratory as well that serves all over the country. And I do a lot of lecturing. And I'm now lecturing at this new podiatry school that opened in Pomona. I'll be heading out there tomorrow. And as they say, I've learned a lot from my teachers. I've learned a lot more from my colleagues. And I learn most from my students. And it's very true. The more I teach, I learn more from them than I do from others. And it's only proven to be true. This lecture was set up by my main nurse who takes care of house calls and homes, etc. Her name is Carmen. She's the one who takes care of setting up house calls if someone can't get out of the home. We always feel it's better that someone does come to the office because it's much better for people to get out and live. And I don't minimize the amount of importance of people coming to a doctor's office way more than just the actual foot condition they're coming for. There's a whole world that they're bringing into their life at that time. I'll get a student who'll say to me, oh, an ingrown toenail came into my office, into the clinic the other day, and blah, 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 blah. I said, an ingrown toenail came in. I said, what happened to the rest of the guy? You got to remember there's a person attached to that foot. So you always got to remember, say hello, ask them about their life, make sure they're a person, you're a person. Sometimes your personal interaction is more important than the actual problem they've come in with. So I made a little skeleton. That's a podiatry joke, a skeleton, talking about feet. And I'm just going to go through these different points here. I have a few things to show you. And my favorite part of a talk like this is opening up for questions. And if anybody out there has a question, you can always email me. Or you guys can email me. It's on my business card, and I have a website, et cetera, et cetera. I get a lot of questions on my emails, and I'm always glad to answer them. Don't let those people out of here. Okay. Bad joke. Okay. First of all, intro, that's me. And I like what I do. And people always say, oh, they like coming to see me because they can tell I like what I do. I had the doctor that I worked for when I first went into practice, he wasn't highly trained, but people really liked him. And he used to have a little note on his telephone. It says, people don't care how much they know, but they know how much you care. And again, that's probably just as important as your knowledge level, because most of the things that we treat in patients don't require a high level of knowledge, which is true of probably every medical profession. It's the 10% that require the high level. The other 90% require just being able to do a good job and making people happy. 26 bones. 26 bones gives us a lot of opportunity for problems to occur anywhere around the foot. We have a very large heel bone, ankle bone, and numerous bones in all the toes. We also have, in podiatry, podiatric medicine, we have to be knowledgeable in dermatology, neurology, musculoskeletal, vascular. So when you come to us, we're checking the entire system of your body, which oftentimes reflects problems that are occurring elsewhere. I've picked up cases of, I've been able to diagnose gout in patients, diabetes, infections, all kind of osteoporosis, all kind of things during the course of my exam, because we have to look at all the different body systems as they manifest in the foot. In order to deal with that, I'm going to use that to explain common foot ankle conditions. But first, for giveaways is what I have over here. This is a little sheet that explains how to buy shoes. This is my foot Bible on how to buy shoes. I'm going to leave this here, make copies for anyone who wants. There's 3 main things I want you to look at whenever you go to buy shoes, with a little caveats here and there. First of all, Mary, you can make copies anybody wants. The back of the heel of the shoe should always be perpendicular to the ground, because we don't want the shoe to influence your foot to turn in, which is pronation, or out, which is supination. It's the direction of ankle sprains. We want the foot to constantly be directed straight. Secondly, we want the bottom of the shoe to bend right at the ball of the foot, as you were asking me about. If the shoe bends at the ball of the foot, it will allow you to progress forward without resistance that will put force back on your knee. And if the shoe bends in the middle or it's too flimsy, it will encourage flattening of the foot. So we want bending only here, and we want it pretty flexible. If you want afterwards, you can bring me shoes. I'll test them for you. Third, I have people that come into my office with shoes that they buy at Nordstrom's, Nike Town, whatever. Dr. Ross, say these shoes are okay, and we don't need a visit for that. They come in, takes me a minute, keep it, dump it, whatever. Next, the bottom of the shoe must be stable, because the purpose of the shoe is to protect us from any kind of sharp objects on the floor, keep us from lacerating our foot or damaging our foot, and to provide a stable platform. We're really not looking for support from a shoe, and I'll explain that momentarily. We want a stable surface. We want the shoe to come to a very quick stop. There are many shoes that are sold that wobble, which means every step you take, the foot wobble, 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 and your muscles have to overwork to compensate for that. Those people